So today we are very honored to have Dr. Jennifer Yao presenting on the BC Stroke Strategy Service Delivery Framework for Stroke Rehabilitation and Reintegration. Her presentation will take about 35 minutes, leaving plenty of time for questions. Dr. Yao has served as the chairperson for our Rehabilitation and Reintegration Working Group since its inception. She also sits on the steering committee for the overall stroke strategy. Dr. Yao, in her day job, is a UBC clinical assistant professor and works on the Acquired Brain Injury Program and Adolescent Young Adult Program at GF Strong Rehab Center. She also serves as a consulting physiatrist at the Vancouver General Hospital. Her clinical and research interests include stroke and brain injury rehabilitation and cancer rehabilitation. She is an active member of the Canadian Association of Physical Medicine and Rehabilitation, and as I've indicated, chair of our working group. We welcome you, Dr. Yao.
Thanks very much, Diane, and welcome to everybody across the province. It's great that there's so much interest in this. And as Diane mentioned, we are quite pleased with this document that we've come up with. It's really the result of a series of meetings that we have held over the last 2 years. And as I go along, if you do have questions, please just make a note of them. And we should have plenty of time at the end to go through questions and have some discussion about this. So does everybody have a view of the actual slides now at the different sites?
No.
No? So, okay, I will try to outline what I can verbally in terms of what's on the slides. There will be some slides later on that are going to be a bit hard to see just because of the way it's diagrammed, and I will try to describe those to you as well. All right. So our vision from the start of the process was really to try and develop a stroke rehab plan where patients can have access to appropriate and timely rehabilitation and reintegration services, and that these services would be delivered in a comprehensive and coordinated way by providers who have experience and knowledge in rehabilitation care. So we did acknowledge right from the get-go that there are significant challenges across the province right now in terms of accessing stroke rehab, both in the inpatient as well as outpatient settings, and most of those are because of limited resources. There is evidence for the efficacy of stroke rehab, and that is now fairly well documented in the literature. There are also several sets of guidelines and standards, best practice recommendations that have been developed and are available for reference. However, being able to organize a system to actually implement these best practice recommendations seems to be the greatest challenge. And that's what we discussed from the initial meetings that we had 2 years ago. It was to try and tackle this to see if there's some way that we can try and improve the actual delivery of services to patients. So back in 2008, we came up with 4 different proposed projects. But because of funding limitations, it was felt that having a stroke rehab delivery framework was probably the priority in terms of being one of the 4. So this became then the focus of the work over the last year and a half or so. So the service delivery framework is evidence-based, and it's meant to cover the continuum of stroke care all the way from stroke admission to patients going back to living in their own communities post-stroke. So this framework is quite broad. It is not meant to be an implementation manual by any means. It is really meant to act as a guide to assist healthcare administrators in orchestrating stroke rehab resources in a consistent and evidence-based manner across the province. So we've included in this framework service delivery components. We've looked at various criteria and guidelines and process models, and hopefully that all put together will be able to help the regions and administrators adapt the framework to their own uses in their own centers or healthcare authorities.